Hello, Jocelyn. We just got done doing the history and physical on the knee, and we are now going to do our physical examination. The first thing I'm going to start with is inspection, and I'm going to inspect these knees bilaterally. Okay? What I'm looking for is an alignment, and that's valgus and varus. Now, valgus is when your knees go together like this, called knee knocking. Okay? And varus is bow-legged, when your legs come out like that. Okay? And then, so the next thing I'm going to assess is, or inspect, is quadriceps atrophy. Okay, I don't notice any quadriceps atrophy, but then also we're going to be looking at the normal hollows of the patella. Okay, which everything looks normally shaped. I don't see any effusion or fluid accumulation or anything like that. Okay. Next, we're going to take a look at the popliteal fossa swelling. So that would be under here, any swelling underneath the legs like this. So we're going to check that bilaterally here. And then what we also be looking for is a Baker's cyst. Okay? And then the next thing we're going to do is we're going to look at the knee effusion. Okay, so do we see any accumulation of fluid that's making the knees pop, look like popped out with basically any features of the knee showing. Okay. So then we're going to go ahead and we're going to move into palpation. Okay, I'm going to palpate the knee. Okay, first thing I'm going to palpate is the suprapatellar pouch. Okay, which is right above here. Okay. So what I'm feeling for here is any kind of swelling. Also, is there any tenderness? No? Okay. And then same here on this other side. Alright. Then I'm going to check the knee on the sides of the patella. For same thing, I'm going to feel for any fluid accumulation or any tenderness. Anything tender right here? Okay, same on this side. Alright. Okay, then I'm gonna palpate the tibiofemoral joint space, which is right below here. Okay, same thing. Any fluid or swelling right here or tenderness? No. Okay, and same on this side. Okay, good. So what we're gonna do now is I'm gonna do a passive range of motion. We're gonna do some flexion and extension of the knee. Alright, so I'm going to lift up your knee here, and then I'm going to do some flexion, 90 degrees. Okay, and what I'm feeling for is any crepitus, okay, or any clicking in the knee. Okay. Okay, good. And then that's the flexion, and then down is the extension. Okay, flexion and then extension. Okay. Now we're going to do some various tests on the knee. One is going to be the valgus stress test. Okay. And what we're going to do for that is I'm going to put a pillow under your legs like this, and that extends the knee about 20 degrees. Okay. I'm going to place my hand on the lower femur, and then my other hand's going to be on your medial ankle. Okay. And then I'm going to rotate outward. Okay. Okay. And what I'm trying to look for at this point would be any kind of meniscal tear or pain, strain on the meniscus. Okay. And then I'm going to do the same thing on this other leg. Okay. Pushing laterally. Okay, then we're going to do the varus stress test. It'll test the same area, but in the opposite direction. Okay, so what I'm going to do here is I'm going to place my hand here like this, and then my hand's going to be on your lateral side of the ankle, and then I'm going to inward like this. Okay, any pain with that? No? Okay. No? Okay. Good. Okay, the next test is the Lockman's test. Okay? So with the Lockman's test is I'm going to check the ACL, which is your anterior cruciate ligament, and your PCL, which is your posterior cruciate ligaments. If there's any tear or damage to those ligaments, then I'm going to get a lot of movement. If it's anterior, I'm going to get a lot of movement forward, or if it's a posterior cruciate ligament tear, then it's going to be a lot backward this way, okay? So what I'm going to do is we're already 20 degrees, okay? I'm going to stabilize by holding on to the femur like this, and then I'm just going to pull, okay? And then I'm going to go back, okay? So pull like this, and then back like that. Don't feel a lot of movement, which is good because those ligaments will keep in place. Any pain at all when I do that? No, okay. Same thing I'm going to do on this leg, okay? Pull out and push in. No. Okay, so no pain there as well, right? So with this type of test, you have to make sure that that there's no PCL tear initially, because then this test would not necessarily be indicated for this, okay? And now we're going to do a drawers test, okay? Almost the same thing. So for this, I'm going to remove this pillow. And good, you have your legs in 90 degrees. And then I'm going to go ahead and I'm going to sit on your foot here to stabilize it. And with 90 degrees, I'm going to do the same thing that's going to test the anterior cruciate ligaments. And then I'm going to pull forward on it, okay? Like this and like this. And then on the same side. Any pain? Okay. So I don't see a lot of movement, which is good. Okay. And the next test is going to be the McMurray test. Okay. The McMurray test will test the ligaments in the knee as well. Okay. So I'm going to go ahead, and what we're going to do is I'm going to bring up your knee 90 degrees, and then I'm going to rotate your knee out laterally, and then I'm going to push it up, and then I'm going to feel here for any crepitus, okay, as I come down. Nothing there. I'm going to same thing here, and here, rotate outward like this, up, and then down. And then you can also do this on the opposite. I'm going to invert, rotate up, and then down, to inward like this, and then down. I don't feel any crepitus, okay, in there, and everything seems to be normal and healthy. And thank you for letting me do this assessment.